Hi, this is the Magnificent Midlife Podcast, and I'm Rachel Lancaster. This is where we celebrate women in midlife and beyond. We challenge the status quo and bash those negative stereotypes about being an older woman. We're not over the hill at 40, 50, 60. We're just getting started, and the world needs us now more than ever. I'll be talking all things midlife, about issues that matter, and sharing fabulous stories of amazing women doing very cool stuff. Now is our time. My guest today is Dr. Kristie Ennis, and she is a physical therapist, nutritionist, and strength and conditioning specialist. She wants to empower people to do more than they think they can, and that they are stronger than they think they are. She has a fantastic YouTube channel, which is where I found her when I injured the meniscus in my knee. Welcome, Kristie.
Thank you very much. Happy to be here.
I was just telling you before we hit record, but it was so nerve-wracking when I hurt my knee and I didn't know what I'd done, but I sensed it was the meniscus and I went searching and I found you, and you were very reassuring. Very reassuring that this was not the end of the world, that, you know, there was natural healing in my future and that I didn't necessarily need to have surgery. So how did you get so passionate about what you do?
I have been in physical therapy pretty much my whole life. As a young teenager, I shattered my ankle and I was told I would never run again. And I would most likely never walk properly again either. So, I know, traumatic for a teenage athlete, certainly, right?
Oh my goodness.
So I actually started physical therapy at my request, not the surgeon's. And I was in physical therapy, probably 2 years. But because of that and all the other things I've done, that was the spark right there. I've actually been able to complete 2 Ironman races, which involves, a marathon of running. So without that physical therapist, I would never have been to where I am. And so that really, and I've always loved to move around and I'm not a good sitter. So it was really that physical therapist that set me on the journey to be my own physical therapist.
Wow, that is some story. I can't imagine. So how old were you actually when that happened?
I guess I wasn't that young. I was 15.
That's pretty young.
It was young enough to be. I didn't drive till I was 17 because of that, actually. So,
yeah, wow. But then that, at a very early stage, that put you on a course of wanting to heal other people.
Yes, and the biggest thing I think for me with that was that I was told I couldn't do it. Right. And so I worked very hard until I found a way that I could. Now, I'm not saying everything will work out, right? That's not life, unfortunately. But I hear so many patients, and I heard so many friends at the time say, oh, they told me I can't do this. So I'm never going to be able to do this again. I'm too old. That's my least favorite. So I decided there's no way I'm going to let that happen. I'm going to do everything in my power to do what I can do to help. And if I can't do it, I'm going to rack my brain to at least think of somebody else that maybe can help. So it really did spark the fire, I guess we'll say.
Mm. But the body's really good at healing if we let it heal, isn't it?
It is. Although, like I said, and like I had said in that video too, there are times when surgery is inevitable, right? I mean, my whole ankle was exploded. I've had multiple surgeries on it at this time. If I just let that heal itself, it wouldn't have, and it wouldn't have healed well, right? But there are many areas of the body that clearly our body can do a great job working with itself. I had a patient once who said that the brain is stupid and the body is smart, right? Our bodies try to get us through however that they can find a way to do so, right? So, in my job, my goal, right, is to find all of those possibilities for people that they can work with their own bodies, as I've had to do with many injuries and illnesses, to get them to where they still need to be and want to be to live a very happy and fulfilling life, right?
And when did you start your YouTube channel?
I would say probably about 6 years ago, I believe.
Because it's...
that was a very random occurrence.
Was it? Tell me about it.
Well, I had a patient who was also a friend who had tennis elbow. And, you know, I helped her and she said, you know what, there's got to be a way that you could probably help other people too, even if they can't come see you. So I'm like, okay, let's make a video. So it was after work in her house. You know, it was dark, no light, no audio, no anything, right? It was just like, well, I know this is what works. So I came up with a video and posted it and probably didn't post another thing for another 6 months. I had like 0 views on it. And then all of a sudden it took off. I have no idea why to this day. But it was my first video to certainly reach 1 million views. And like I said, it completely, if you look back at it, it is my first video and it looks very, very different, right, than the videos that I have now. Once that took off, then I decided I should probably be consistent about this. And I wanted to be an actress as a little kid. So I figured this is really the best of both worlds. I get to be on film, so to speak, and help people at the same time. So I couldn't think of a better option than that, honestly.
Wow, that's brilliant. And it just randomly went popular and people saw it. 1 million views. That's amazing.
Yes. And then, you know, like I said, it took time to build the entire channel. That was just one video and the rest of them took a very long time, probably a couple of years. But yes, with consistency and with, like I said, I clearly love what I do. It just has taken off. And for me, I hate to say it, but COVID was actually a good thing. Everybody was inside. And so people were looking for not just how can they help their bodies heal, but how can they stay healthy and in shape and, you know, whether that's exercise, nutrition or injury treatment and prevention.
And there is so much information out there now.
So
it blows my mind. I mean, I didn't realize, I do have a physio here and I went to see my physio yesterday actually to get, you know, proper, I suppose, bespoke advice for me and my knee on the next stage of my recovery. But for the period when I was literally sort of deer in the headlights, what have I done to my knee? To be able to find something as specific as you and the detail that you gave me in terms of, you know, what I could do now and what you could do in a little while. And that was it was brilliant. And it was amazing. That's why I really wanted to have you on today, because it was very, very powerful. And I think we forget the possibilities in the way we can operate, in the way we can do business. And I think in particular as women, I know as we're getting a little bit older, there's all sorts of things that we can explore and things that we can do. And you, as you say, you took your practice to such a different scale by embracing doing it online, didn't you?
Yes. Very, very different, very wonderful.
Yeah. And you have this tool as well, which I was really interested in. Tell us about your tool.
So that is called the Derma Edge. And I actually created that when I was diagnosed with Lyme disease, you know, probably around the same time I created my YouTube channel. I actually had some neurological Lyme disease. So I lost reflexes in my left side, in my arm and my leg. So I had a foot drop, a fair amount of weakness and a lot of pain. So there were times that I was not getting out of bed at all. And my whole body hurt. I said, I have to do something to make this feel better. This is not okay. And I have to be able to do it on my own because I can't drive right now to get to somebody. So it actually started out fashioned as just a door hinge is actually where I took the shape from. And because that's what I started using. And I said, okay, well, this is clearly not comfortable to grip. I had a local friend who was willing to help me come up with a prototype. And so the whole goal of it is that you can use it anywhere on your body to help release tightness and pain. And it's designed too so that it's not uncomfortable if you have hand issues or wrist issues, that you can actually grip it without having to grip for dear life and still utilize it all over your body. And it's because of the material, it's an aluminum, you actually can feel the bumpiness where all of that tightness lies, wherever your issue happens to be. So it doesn't require a lot of force then to make a change either, because that tends to be much more of a surface and the receptors on the skin talking to the brain. So that, again, came about because of an illness. And that's also another of my goals, is to use anything that happens to me to help somebody else, because somebody else is going to be going through what I've gone through, right? So yeah, that's it in a nutshell.
Yeah. But it's very similar to the tools that are used in traditional Chinese medicine.
Yes. And actually that physical therapists use as well.
Yeah. Which I discovered after finding you and your Derma Edge, and then sort of trying to find something similar over here. And I discovered all of these things. And then I also know, I keep hearing about the importance of fascia, and
Yes.
then I forget about it. And I don't really understand
Okay.
what it is and why it's important. So
Okay.
can you talk a little bit about that?
Most definitely. So fascia, to give you an example of what fascia looks like and is, if you look at a raw chicken breast and that white filmy skin that lies over that chicken breast, that's fascia. So fascia is connective tissue, and it literally attaches our body from head to toe. So you have fascia that lies over all of your muscles, and it truly connects the whole body. So the amazing thing about it is that it helps us move. So it has to have enough gliding ability for our, movement to occur, but it also has a significant amount of strength. So it's actually part of the supportive system as well. So what happens, and a lot of times when people have an injury or they just have a lot of tightness, that can occur from overuse, time, right? Not moving. That fascia and the muscle get stuck together. So if it was my arm, and let's just say it was in the shoulder area that I was having some of that tightness, it would cause a limitation for me to be able to move my arm. So because it gets stuck together and the liquid that's in between there gets thick and almost honey-like, I'll use as a description. And so things stop gliding. So the whole purpose of this tool is not to actually, it's kind of a misnomer. We call it fascial release, but it would take hundreds, if not thousands of pounds to actually release the fascia. What we're trying to do is get those layers to glide so that that fascia now moves the way it's actually supposed to, therefore allowing your body to move. And the same thing is true of like scar tissue, or you've probably heard of the IT band or the plantar fascia, right? Those are bigger, thicker collections of that connective tissue.
So we think so much about the muscles, yeah, but fascia is very much a new thing to me, but
It's very important.
it's very important, isn't it?
Yes.
And how can we take better care of it?
So there's a few ways. Number one, and this is almost everybody tends to not quite drink enough water. The more dehydrated you are, the more stuck those layers get. So that maybe by the start of the day, right? Let's say your neck hurts and that's tight. And then it actually can translate down the body because it connects together. So I've had as simple of a solution, honestly, as people just making sure they drink enough. That sometimes cures it all. Now, that's not always the case. But if you really do not drink enough fluid, and that's all fluid, right? It doesn't have to just be water. That's always step one for people. Step two is getting movement. So if you're someone that happens to sit a lot during the day, which is almost everybody at this point in time, except for me, yay, getting some gentle movement frequently. And where I find that people tend to go wrong here is that they'll do 30 seconds or a minute of stretching a couple times a day. But that is definitely not enough to break up 8 hours of a pattern, right? So what I find the key is that people do little small movements throughout the day. So for example, if I have, tightness in the neck, doing some shoulder blade squeezes, some chin tucks, even just some head tilts, right? Using the Derma Edge on all of those spots. And doing that, what I just showed you takes, 20 seconds, right? If you really, really kind of go through a whole pattern there. And doing things like that multiple times a day makes a huge difference for how our fascial system works. So I often say that to people too, doing yoga. I love yoga, and yoga is wonderful, but doing yoga 90 minutes once a week is not going to make a drastic change in how your body is working. So you can still do that. That's lovely, but add in another, daily 5-minute segment here, 30-second segment there, just to break all that up and get things to continue to glide. So those would be the biggest things: water, movement, blood flow. So that's where the Derma Edge comes in. Sometimes people will even just, throw a heating pad on, right? You're truly heating things up. So.
And that was the thing about the Derma Edge with the meniscus injury, wasn't it? Was to get the blood flow moving around that area.
Exactly. And any injury is going to have poor blood flow, right? That's just what tends to happen, especially as scar tissue starts to form. And again, some areas have worse blood flow than others, including, like I said, the plantar fascia, the IT band. Depending on the meniscus, one side has better blood flow than another side does. So it does make a big difference to work all of that aspect. And again, sometimes it's coming from a spot different than what we think, right? So let's just say you had ankle pain. I'll use that because clearly I do, right? But it may not even be coming from your ankle. It may be that your quad, the top of the thigh muscle, is so tight that that's where the fascial restriction is, and that connects all the way down. So that they've actually done studies showing where when people start to loosen up here, their ankles and feet actually release a little bit too. So that's how important that whole connection through the body is. It's huge.
I'm so glad you said that, because one of the things I get very frustrated with, and I know it happens in US medicine and it happens in UK medicine, in the Western medicine, we don't have this holistic approach, do
No.
we? We
No.
break it down, you know. So I went to see a knee specialist. But I know, having spoken to my physio and having, you know, watched people like you, I know that my hips, you know, are just as responsible for the
That's right.
pain in my knee as my knee is. And yet my specialist at the hospital was just looking at my knee.
Yep.
He wasn't looking at me, my gait, how I walk, how I'm moving. And it's so, so important, isn't it? I think it's important at any age, but especially as we get a bit older.
It is. And actually, starting at the age of 30, which is quite young, is when our tendons and ligaments start to lose their elasticity. So you add that into every other, right, perfect storm of factors, and it can be a challenge.
Yeah, yeah. So what do you see happening to women especially that we can either, you know, work to not let happen, or how we might fix it when it does happen?
Okay, that's a great question. If we're really looking at things like hormone related, right, because that's a huge thing for us women. Men have hormone stuff too, but it's a different situation. So in menopause specifically too, what happens is we get a decrease in estrogen, right? And then what happens is follicle stimulating hormone increases, which actually tends to put fat in the belly. So no matter how hard you work, right, there's that little component of it. And then as progesterone decreases, cortisol, which is our stress hormone, actually increases. Oh, and also with a decrease in estrogen, you actually get an increase in inflammation, right? So if you have more aches and pains after going through menopause, it's not just because you're getting older, right? There is actually a hormone component to that. So to kind of counteract all that, there are some important things to do. Number one, from a dietary standpoint, eliminating as much sugar as possible. We know hands down, regardless of people's allergies, whatever, sugar is an inflammatory causing agent. Okay. Now, I love sugar. Don't get me wrong, right? I'm not saying you have to eliminate all the things that you love in your life, but if you really pay attention to food labels, and I'm not sure how it is where you are, but I'll look at a label and it'll be, guacamole, and it's got added sugar. And I go, what in the world, right? So making sure that at least your food doesn't have the added sugar in it. If you really want sugar, know that you're eating it like a brownie, right? Versus salsa or guacamole.
Yeah.
Again, the hydration is an important factor, right? What people, especially in this area, and I'm assuming where you are too, this time of year, especially, although the sun is shining through right now, vitamin D levels tend to drop pretty drastically. Low vitamin D actually increases inflammation as well. And as we get older, that actually tends to even decrease a little bit more. What people don't tend to know is that in order to really get vitamin D to absorb well, you actually need magnesium. Now, most people think about calcium and vitamin D going together, and those are great. But magnesium is also important. And the other thing with magnesium, because it is difficult to get in the diet, sometimes that can lead to, cramping and different muscle aches and pains also. So I always still do tell people, though, if you're looking at supplementing with vitamin D, because it's a fat-soluble vitamin, that means it can stay in your cells if it's not needed. Versus vitamin C is water-soluble. You just pee it or poop it out, basically, if your body's not using it. So I do always think it's helpful to have, your doctor have a blood test, at least to know where your levels are, to make sure that you don't go. Like I said, most people are going to be low on that anyways, especially women as we get older. But it's always safer to check that out. And then, like I said, the magnesium, the side effect from too much magnesium is pooping, which is why sometimes they use it as kind of like a laxative, right? So dietary wise, those would be the biggest things. And then increasing the amount of antioxidants that you can. From a fruit standpoint, berries are going to be your best bet. Strawberries, raspberries, but all the berries. Green leafy vegetables. It's kind of like, what you would think of as a normal healthy eating pattern, probably. And beans are another really good source too of antioxidants. So you can be vegetarian and still, right, support yourself well with that. From an exercise standpoint, not even just the belly fat, but we'll definitely specifically the belly fat as well. So this is where strength training becomes very important. So number one, strength training actually can increase mobility, more typically because you're working through a range of motion, right? Number two, as you build muscle, your resting metabolic rate actually increases, right? So you're actually able to burn more calories just sitting here being you than when you have less muscle mass. Now, you cannot spot reduce any area ever. But if you've got weakness anywhere, and there's the other thing that happens, every decade, our muscle mass decreases unless you work on it. So you can actually stop some of that from occurring. But as things get weaker, right, that's also can lead to some of that abdominal, I call it blooping, right, that pushing out. So you can't reduce those abs, but you can make them stronger, which then will help support you and actually give a slimmer, for lack of a better word, a slimmer look. So the recommendation for strength training is 3 days a week. What I find tends to be the easiest for people is to do total body 3 days a week, not consecutive days. You never want to strength train the same body part twice. And as we do get some aches and pains, it does not need to be heavy weight. I sometimes think that's a misnomer. You can do it with bands. You can do it body weight. You can do it with resistance bands. The key is working until you are just about at fatigue. So I'll use bicep curl again because that's an easy one. So let's just say I was using a 3-pound weight and I'm on rep number 15 and I'm like, oh, this is so easy. But by the time I get to rep number 18, I'm like, okay, it's really getting definitely tricky to bring that weight all the way up. That's kind of how you know, like, okay, that's good, right? So even if you do have pain and injuries, you can easily modify to still build strength, which then also builds bone, right? That's another thing we have to think about too as we get older. And that is the one thing that being a thin white female from a disease state is actually bad for. You have a higher risk of having osteoporosis when that's the case. So sorry, that was a whole lot of everything again. So please feel free to, I didn't give you a chance to even stop and ask me anything.
No, that's brilliant. That's brilliant. That's what I wanted. That's great. And are there any injuries that you start to see more of?
Yes.
I mean, like me with my knee.
Yes. I mean, it obviously runs the gamut, but some common things are hip pain and bursitis. For whatever reason, hormone-related hip bursitis, it becomes just very prevalent. Rotator cuff tears and frozen shoulder are also common once we start to get older. And then, of course, all of the overuse stuff that, again, just kind of builds up, right? Arthritis, even just neck spasms and things from years of doing this, right? So those would probably be the most common areas that I see.
And what can we do about those?
So I'm going to kind of go body part by body part here a little bit. With regards to neck and shoulder, and it's not just about what you can do, but what you should be cautious of doing too, right? So certainly from an exercise standpoint, if you've got shoulder issues, if you have neck issues, I always tell people to avoid forward raises, lateral raises, and upright rows. Those are hands down, get those out because they put a lot of strain on there. Some people don't do well with things like overhead pressing either. That one is kind of a 50-50. So clearly, if it were to cause discomfort, you don't want to do that, right? But those first three, hands down, without a doubt. With regards to some of the lower body stuff, what I tend to see a lot of is lack of hip flexibility and lack of hip strength, right? It's the side glutes, it's the back glutes, not as much as the front of the leg, but the side and the back of the leg, again, tend to get weaker. One, because we are sitting so much, those things tend to shut down. If you've ever had any back injury too, some of those also shut down. And then they're generally not focused on, even if you go for a walk, which is lovely exercise, you're not really engaging those muscles that well. So I see people a lot, especially right as we're getting older here, that they love walking. It feels good on their body, but, right, maybe their knee starts to hurt or something, but they're not using, these muscles aren't supporting, right? And they attach down around the knee. So that'd be kind of the biggest areas that I see.
That's exactly my problem. I mean, and I kind of knew it. I know I have very stiff hips. I know, even though I'm currently standing up at my desk, I sit down a lot and I get stuck. I don't get up as much as I should do. I have very tight hips. And I've been trying to loosen them up, and I think maybe I overdid it and, didn't help the knee in doing that. But when I went to see the physio, he very much said, yeah, it's your glutes. It's the glute, especially on the right-hand side where the right knee is the problem. I don't have enough strength in that. So now I'm regularly doing the clamshell exercise.
Oh, good. Okay. That's a good thing. And if you think about it, so the glutes help to pull our leg out, rotate our hip out, right? So if they're not working, your hip's going to rotate in more and put pressure on the inside of the knee. Right. So that's really where a lot of that comes into play. So I'll see that, right? The meniscus or the ligament even, or I'll see arthritis that tends to be here more than anywhere else. And the same thing with the ankle, all coming from here, back pain too, right?
How else can I strengthen that area then so that I don't... So this is my own personal physio session now.
Oh, this is great.
Because I want to protect my knee. And I know it's a big issue for a lot of women.
It is.
Our knees, they start to get a bit niggly. And, I'm a runner and I haven't run since June because it started to hurt and, I'm getting nervous about it. And then I had the meniscus injury after I'd already started having physio on the knee. And I don't know whether it was a new injury or an exacerbation of the existing injury. Difficult to know. But anyway, I'm in this situation where I'm nervous. And in fact, yesterday I said to the physio, I said, well, if I can do my long walks and I've got to give up my running, then I'll have to give up my running. And he said, no, you don't have to give up your running. I think you can be back to running by Christmas. And I went, really? It's now the beginning of November, folks, when we were recording this. So I was sort of like, wow, I really was beginning to sort of modify my expectations.
And that's where like there's a way, right? Most often there's a way to get to where you need to be. Not every time, but again, I'm assuming he's working with you on glute exercises, right? Besides the clamshell. What other exercises besides
lifting my leg up completely on the side.
On your side. Yep.
Yeah.
Things like bridges. And bridges with a hip abduction actually really kick those in
with a band on as well. Is that what you mean?
Yes. Yeah. Right. The lateral walks with the band, those usually are pretty good. Even standing exercise where let's see if you can see me. I'm still attached here, so I don't know. But standing with a band and just bringing that leg out to the side and bringing that leg behind, right? Not arching in through the back. But those are great isolating exercises for the glutes. And actually, I oftentimes start people with those because you can cheat in some of the other exercises. Like I said, right? Our bodies are really good at getting us through things. So I often use those. And actually, those are exercises. I do them with a cable at a pulley system. And I do those every time I do some strength training. So those would be kind of a good addition. I think I have multiple videos on there now with some glute stuff on it too.
Yes. You're a very good resource. I have to say, everybody just go and check out Kristie's YouTube channel because it's a brilliant resource. It really is.
But yeah, so you cannot go wrong by continuously strengthening in through those glutes. And again, it's all parts of them, right? It's the side, it's the back, and you've got, two on the side, honestly. And that piriformis often gets tight, but a lot of people forget that can get weak too. So clamshell will hit that as well. But that, I more often than not, if we're talking anything from the back down, there's hip involvement. Even pelvic floor inside stuff, there's hip involvement.
Really? Tell me about that.
So with your pelvic floor actually makes up part of your core. Right? So just like your abs, your hips. So if there's weakness there, something else has to take over and there tends to be stress placed on areas. Okay. If there is tightness there, you actually have deep hip muscles that attach in the same spot. So when there's tightness in the pelvic floor muscles, there's tightness in those hips, and vice versa. So that can cause, right, things like painful intercourse. Even sometimes women will even just have difficulty with their, gynecological exam because things are tight and sore. So you can't address one without addressing the other from a strength and from a flexibility standpoint.
Wow, it's really interesting because we assume it's just purely hormonal, don't we? I think.
Yes,
There's a tendency to assume
that's one of my goals in life, is to get people to realize, to get education out there for women that going pee a little bit when you're not expecting it is not normal. That is not a normal part of.
Oh yeah. Oh my goodness, and I hate the products that are advertised for female incontinence. They are changing a little bit now. There's the people in the UK who are talking about pelvic floor exercises at the same time as they're advertising their incontinence products. But there's an idea that, you get to a certain stage in life and then you're in the incontinence products forever. And it really shouldn't be like that. As you say, it's not normal, and it can be fixed. For most women, it can be fixed.
Yes. And, sometimes also what happens, right, as you lose estrogen, things start to thin a little, right? And so things get tighter. So sometimes it seems like something is weak because you're maybe getting this leakage, but it's actually tightness. And those muscles are having to work so hard all the time that they're really just tired, and now they can't hold anything in. So I tell people also, don't just automatically start doing Kegels until you know. So some of the signs that you have tightness are, again, right, the tight hips, tight back. If you have to kind of sit with your legs open like this, right, in order to get comfortable, that's typically a sign. If you have multiple areas of your body that are painful and tight, odds are that tends to come with it. Any sort of trauma, it doesn't have to be sexual, but certainly sexual trauma, at whatever point and stage in life will cause tightness in there. And it is, if you have a lot of stress, we often think of people holding stress here, but women very often hold it in their pelvic floor. That's the center of us. It really is, right? And so that sometimes is where things go. Yeah.
And in the hips as well, isn't it? Is that right? That we carry a lot of stress and tension in our hips. That's my excuse. I'm saying I've realized it's still my stress.
That's it. And you just have to get rid of your stress, which is easy to do.
Oh yeah, absolutely. That's a walk in the park. So what are some common mistakes that you see women making?
And with regards to exercise, or be a little more specific if you can, because that's
anything. So anything at all. What do you see?
Okay. I think one of the most common things I see is actually, believe it or not underdoing, but overdoing. So I have a lot of women that come into my office that, were told they needed to exercise. So they join a boot camp class, or they join like a CrossFit class, and it's intense every day they go. Right? So they come in and they have a rotator cuff tear, or they have, right, a hip impingement or something like that. So it's awesome to start moving, but especially as we get older, you cannot do the same intensity, even though we think we can, as when you were, 20. So there has to be more rest breaks in between some of those. So if you were to do something hard on a Tuesday, then you don't want to do that Wednesday or Thursday. Friday, maybe Saturday, you could do something a little bit more vigorous again also. But that's where I see a lot of injuries come in. People are like all excited, right? Which is great. You want people to get moving, but then they go way overboard. And like I said, maybe they haven't exercised in years and they could do this, right, years ago. Now, that's just not how our bodies work anymore. So that would be the biggest thing. Under eating. I know that sounds crazy. But when you do not, okay, good. When you do not eat enough, your body, again, goes back a long time, and it has no idea that you're trying to lose weight. It thinks you're going into starvation mode. So it tries to protect you by lowering your resting metabolic rate, which, right, we talked about that before. That's bad. And then you start to burn protein, okay? Because you're not having enough calories. Your body's like, oh my gosh, your brain runs on glucose. That's it. So your body has to burn it from somewhere else. And yes, of course, it will burn some fat, but it starts to burn protein also to get some of those molecules so that your brain isn't starving. And when that happens, your muscle mass decreases, right? So your resting metabolic rate drops no matter what. Now your muscle mass is dropping. And then what typically happens is nobody can maintain 1,000 calories for the rest of their life. So they start to eat a little bit more and then they gain weight. But if you are just at that level, that often I see people actually gain weight by eating too few calories because they've just lost so much of their muscle that keeps them going, right? So that would be the second thing I see. And it's so hard of a concept to be like, well, I'm eating less. Why aren't I? Right. But you have to have enough to function for your body. So
yeah. And we need fat.
Yeah, those would be the big things.
We need the fat.
Absolutely need fat. Yes. Yeah. I mean, your body needs all of it, including, and I know that's another thing people think that they don't need carbohydrate. That's not true either. Right. Or like I said, that whole cycle. And I think people sometimes forget what a carbohydrate is, but I'll have people tell me they're eating no carbohydrate, but they tell me the vegetables that they just ate or, things like that. So you do have to have those. It all goes back to the same basic stuff, right? Eat as close to nature as you can, right? As opposed to like prepackaged stuff. Get lots of vegetables, get some fruit. If you believe in meat, get meat. You can have a little grain, right? It's not any more complicated than that, but that's not easy. But all of the other, and again, if you don't want to eat something, that's one of the issues I have with some of the diets out there is that they eliminate entire food groups, right? Or are just not sustainable so that you can't live like that forever. And then you start eating normally again. And what happens? You gain weight, right? And that's almost every diet out there. That's my soapbox.
You're welcome to your soapbox. Yeah, I've got a few. So how much time are we talking? If we look at a week or we look at a day or a week, what do you think we need to be doing and how much time?
Okay.
Because we're all busy. So
yes,
how much time do we need and what do you think we should be doing with that time?
Okay. So 3 days a week, really you do want to have strength training. It can be 20 minutes, right? You do not need to sit there and strength train for an hour, especially if you're doing total body 3 days a week. Right? You can do combination exercises like a lunge and a bicep curl, right? 20 minutes, 30 minutes. You don't need to do 45 minutes or an hour, right? So that's an easy, knock on wood, that should be a relatively easy piece. You can do it at home. You can do it at the gym, whatever. I have personal training clients because they don't like to do it at home, right? They kind of know what to do at this point, but they don't want to do it. So they come to see me and that's okay too, right? And then you do still need, the recommendation is actually 150 minutes of cardio a week. And I find that can be challenging if that's not your forte. So if you're brand new, right, then I say 3 days of strength training. Let's shoot for 3 days of cardio if you can. Okay. And then eventually the goal would be, to get it up to that 150 minutes. And the way this guideline is written too, is that's what they're recommending. But if you do more, it's better for your health. Like, whoa, that is just mind blowing, right? Like, but an absolute minimum. Okay. I'll give you my minimum. 2 days a week strength training. You really can't make gains unless you do at least 2. So 2 to 3, we'll say. And then cardio, at least shoot for 3, right? You can get 5 days. That's better, but that would be the place to start, certainly. And cardio doesn't have to be this crazy intense stuff either, right? You do need to get your heart rate up though. So just going for a leisurely stroll doesn't cut it. So if you want to walk and you like walking, you can include that as your cardio. You just have to walk a little faster to get your heart rate up, basically. And I tell people to just use the talk test. So if I'm having a conversation with someone, I should still be able to have that conversation, but I'm probably breathing a little bit harder. And that's kind of your aerobic level right there at the higher end of aerobic. That's an easy guideline instead of checking your pulse all the time and that kind of stuff.
And what other kinds of cardio can we do?
There's so much. I guess it really just depends on what you like, right? So walking, hiking, biking, running, swimming, exercise classes, elliptical, sport. You could take some sports, for example, tennis, pickleball. Unfortunately not. I haven't seen a lot of people get their heart rate up enough in pickleball yet.
Really?
Doesn't mean that you can't. Doesn't mean that you can't for a consistent period of time. Let's put it that way.
So how long do we need to keep our heart rate up for?
So again, goal is 150 minutes, right? But if you're starting out with
the heart rate being up.
Right.
Wow.
Well, that's what cardio is, right?
Yeah. I hadn't sort of made that connection. I was thinking, I'll warm up, a little bit of jogging, warm up, and then I got to warm down, obviously, at the end. So how
But think
much have I
about
got to
that.
actually have my
If
heart
you
rate
really
up?
follow those 150-minute guideline, that's 30 minutes, 5 days a week, right? That's not
Of
that
getting the
much.
heart rate up. That's really
Right.
interesting.
But again, you don't have to think about it being here. It only takes me a couple minutes to get my heart rate into an aerobic zone.
Okay.
Yeah. So again, it's not that you have to be like, it's not high intensity. It's not anaerobic, right? So we're not talking without oxygen. You're just, again, I hate the formulas that are out there. They're not very specific. So I usually don't tell people, 220 minus your age is your maximum heart rate. It varies so much, right? So my guess is we'll take running, for example, right? If you jog.
Which I can't do at the moment.
I know. It probably only takes you a minute or two to get up to the pace that you need to be at. I'm fairly confident on that.
Probably. Yeah.
So again, don't think it has to be this high level cardio, but it can't be just like, right, you're having like I said, kind of just stroll down the road kind of thing.
Yeah. So I get that. But I think a lot of these things, it's easy to let the confusion paralyze you. Do you know what I mean? It's easy to go, well, I'm not sure what I'm really supposed to be doing, so I won't do it.
And you know what? And I often have people come in that haven't done anything, right? Not like they're injured. They just have never been an exerciser. So for people like that, I'm not starting them with that frequent, right? I usually start them from a cardio standpoint, 10 minutes, right? Well, let's shoot for 10 minutes, 3 days a week. And we'll make sure that we get, 20 minutes of strength training in 2 days a week, right? And it's, of course, just like cardio, strength training needs to be modified so that it fits your body, right? You can't sit there and do, 200-pound bench presses followed by, right, 400-pound deadlifts. And, it's sometimes it is literally just, a wall push-up, right? That counts. So you just have to keep that in mind, that if it ever seems intimidating, it means it's probably not the right thing for you. And there's again, right? There's another way to make that work. And it has to work for you.
And I guess there's also like a dance break in the kitchen, isn't there?
Yeah, there is a dance break in the kitchen. There is. Yeah. I actually have some people that are in my personal training groups. That is what they do. If they're just feeling depressed, they'll throw on some music and just start dancing around and feel so much better, right? So, and that's the other thing. That's a great thing about exercise. It will make you feel better, right? At least mentally. So.
Yeah. That's why running is my stress release. When I'm grumpy, I go for a run and I come back, I feel much better.
Yeah.
And so I'm struggling with that at the moment. I'm probably, ask him indoors, I'll probably say I'm extra specially grumpy because I can't go running at the moment.
Well, and again, I'm going through so many of my own injuries and having had times of months on end of not being able to do anything. It never hurts to find something non-physical to help you through things too, right? That's actually when I started meditating, was one of my injuries. I wasn't able to do it. Literally, they didn't want me. Nothing. So I'm like, how am I going to get right? How am I going to get myself through this? So I actually took a meditation program and I went in the hot tub. That was like my thing. So I do highly recommend, as important as the physical aspect is of things, the mental aspect is just as important, right? Whether you're injured or not, it still plays a huge role in how we feel and how we feel about ourselves. So.
Well, again, going on YouTube and Dr. Google, I discovered that, even if I had a meniscus injury, I could still go on an exercise bike. So I got myself a nice economical exercise bike and I got on that and it was brilliant, absolutely brilliant. I felt so much better about myself. I was getting the movement, I wasn't doing any harm to the joint. So it was all very good. And I could get my heart rate up as well. So,
which again is great, but sometimes there are times, like I said, you cannot do things.
Can't do anything at all.
Right.
Yeah.
So, and that's where I'm kind of stressing that it's important to look at the other aspect of things.
Yes.
For that. Yeah. Modify when you can, like you did, which is perfect. But sometimes you just can't.
Yeah. Well, this has been absolutely brilliant. I'm so glad that we were able to make this happen. And thank you very much. I would love to ask you, just as we wind up, what would you most like women especially to know?
Oh, I think kind of what I said in the beginning, that don't ever let anybody tell you no, and never stop looking for a way there's someone out there that's your someone and they're going to help you.
Thanks for listening to this episode of the Magnificent Midlife Podcast. If you enjoyed it, please subscribe, follow, and share it. Also, giving a 5-star review really helps get the word out. You'll find the show notes at magnificentmidlife.com. That's also where you can get my book, Magnificent Midlife, Transform Your Middle Years, Menopause, and Beyond. Make the very best of your next chapter. Help me change the world, one magnificent midlife woman at a time.